and good evening. Welcome to my webinar, Pain Management 101. My name is Dr. Pamela Frank. I'm a naturopathic doctor and clinic director at Forces of Nature Wellness Clinic in Toronto. For those of you who don't know us, we are founded in 1999. We provide a full slate of wellness services to the Yonge and Eglinton community. We offer everything to transform disease and enhance people's health and lives, including acupuncturists, chiropractors, naturopaths, osteopaths, dietitians, and psychotherapists. Let's get into our topic. Pain is defined as suffering or discomfort that is caused by illness or injury. Everyone experiences pain differently, which can make it difficult to define and treat. Pain is your body's way of telling you that there's something wrong. Pain plays an important role in protecting us from harmful situations. For example, when you touch something hot, pain signals your brain to react quickly to the danger. Chronic pain, however, can be debilitating and reduces your quality of life. Some common terms used to describe pain include aching, burning, dull, stabbing, shooting, tingling, sharp, and throbbing. The quality of the pain can provide valuable information about the cause of the pain. Sharp, stabbing, tingling, or shooting pain is more often nerve-related. Aching, burning, dull, or throbbing is more likely muscular. The most common causes of pain include muscle pain, tension, stress, overuse or repetitive strain injuries, minor injuries like strains and sprains, and pelvic pain due to endometriosis, interstitial cystitis, or gastrointestinal problems. There are two main categories of pain: organ or tissue damage or visceral pain, nerve damage or neuropathic pain. Visceral pain occurs when organs, muscles, or tissues are inflamed, damaged, or injured. Some examples of visceral pain include appendicitis, gallstones, chronic chest pain, diverticulitis, and pelvic pain from endometriosis. Neuropathic pain is caused by nerve damage. There are many causes of neuropathic pain. A few examples include diabetes, herniated discs, arthritis, spinal cord compression, and multiple sclerosis. How your body registers pain. 1. There are sensory receptors that send messages through nerve fibers to your spinal cord and brainstem. Secondly, your brain receives a message regarding where the pain is being felt. And lastly, in response to the pain, your brain releases chemicals called endorphins, which are morphine-like substances. Pain research has discovered that brain activity changes in response to acute versus chronic pain. This discovery might explain why treatments that help acute pain aren't always effective for treating chronic pain. Acute pain is relatively more sharp and severe and typically lasts less than 3 to 6 months and is related to soft tissue damage. Chronic pain lasts beyond 6 months and the nerve signals continue firing even after you've healed. Oftentimes, chronic pain occurs without an obvious cause. For some, chronic pain is the consequence of an injury or health condition. Some common causes of chronic pain include 1. Past injuries or surgeries that never fully resolved. 2. Back problems. 3. Migraines and other headaches. 4. Arthritis. 5. Nerve damage. 6. Infections. And 7. Fibromyalgia. Symptoms can range from mild to severe and have been associated with pain that is described as a dull ache, throbbing, burning, shooting, squeezing, stinging, soreness, and stiffness. The main goal of chronic pain treatment is to reduce the severity, as chronic pain can be debilitating and often causes disruption in the activities of daily living. Thankfully, there are natural solutions available for those who are not comfortable with medication and surgery. Initially, you want to deal with the cause of the pain. If it is an underlying medical condition like fibromyalgia, diabetes, or endometriosis, naturopathic doctors can help locate and address the cause of the pain. Additional natural solutions for pain management include chiropractic care, electrical stimulation like TENS, massage therapy, osteopathy, acupuncture, and pelvic physiotherapy for pelvic-related pain. Chiropractic care employs a specialized technique of pain management by utilizing a whole person approach. If you're looking for a safe, natural, and effective treatment for pain management, chiropractic care might be perfect for you. Chiropractic care aims to help relieve pain, improve function and mobility, and help patients better manage their condition between treatments. Treatments start with an initial exam and a discussion of your health history to evaluate your condition and identify potential causes of pain. The procedure of a chiropractic adjustment involves the application of a controlled, sudden force to a spinal joint with the goal of correcting spinal alignment in order to allow full function of the spinal cord and its attached nerves. Research reveals that the services provided by chiropractors are clinically effective, safe, and cost-effective. Chiropractic therapy can also apply the following techniques to ease pain: electrical stimulation, soft tissue work like massage, and active release therapy, and acupuncture. Electrical muscle stimulation is a complementary service offered during chiropractic therapy and is used to reduce inflammation, decrease muscle spasms, and relieve pain. During this process, electrical stimulation is transmitted through pads that adhere to your skin. Light electrical pulses trigger your muscles to contract, mimicking the action potential that comes from your central nervous system. As part of a chiropractic session, a chiropractor may massage the soft tissue to improve circulation and reduce swelling and inflammation that is associated with the pain. This encourages faster healing. Have you ever heard of hydrotherapy? Hydrotherapy employs the use of hot and cold water to stimulate circulation through an area of injury or to direct blood flow to specific areas. Hydrotherapy also improves immune function. Heat helps your white blood cells to work faster to fix a problem. This is why you get a fever when you get sick. Traction is a form of decompression therapy that relieves pressure on the spine and the nerves by stretching and taking the pressure off compressed discs. This process relieves pain and improves your body's ability to heal itself. Like chiropractic care, acupuncture is a form of integrative medicine, and specially trained chiropractors, acupuncturists, and naturopathic doctors incorporate this therapy. For those who are not familiar, acupuncture is a form of traditional Chinese treatment that involves the insertion of thin needles into specific acupuncture points located all over your body. The needles increase blood flow, stimulate immune system repair, and help relieve pain. Most patients report feeling very relaxed during and after their sessions. Chiropractic adjustments and acupuncture work together to provide added healing benefits, as acupuncture helps to relieve the intensity of pain signals and to loosen muscles, which in turn aids in the process of chiropractic adjustments. Self-management techniques allow individuals to become an active participant in his or her recovery. Research shows self-management programs have reduced many barriers to effective pain management, helping people to significantly increase their ability to cope with pain. The best self-management programs help by teaching you various methods of thinking about and responding to pain, thus making their actions to alleviate pain more effective. Experts have identified a number of key tasks to aid in self-management of chronic pain. These tasks include 1. Building a partnership with your healthcare providers. 2. Using medications appropriately. 3. Applying cognitive and behavioral strategies. And 4. Getting help with emotional consequences of chronic pain. For the best results, talk with your healthcare provider, as they are there to answer questions, help address barriers, and encourage self-management efforts. Individuals suffering from chronic pain face many daily challenges. While pain is a huge factor, other challenges include managing symptoms, modifying responsibilities, and coping with the negative emotional consequences. Many chronic pain survivors struggle with no longer having full control over their own life, having to rely on others to help with even mundane tasks. This is why self-management aims to help individuals regain some element of control. Learning how to keep pain from dictating your daily activities is what self-management is all about. A number of techniques have been identified as helpful tools when learning self-management tools to help chronic pain sufferers gain control of their day. Number 1, effective pacing. Number 2, food choices. Number 3, physical activity. Number 4, easing tension. Number 5, sleep better. Number 6, focus. Number 7, positive thoughts. Number 8, ergonomics. Let's discuss each of these techniques further. Many chronic pain sufferers refer to good days and bad days. As pain can be so debilitating on bad days, individuals may tend to overwork themselves on good days in an attempt to catch up on activities that were missed on bad days. This often leads to needing more recovery time following a good day. Pacing is the difference between doing too many activities and not enough. Rather than doing everything on a good day, break up activities so not the pain, are in charge of how you plan, start, stop, and change what you're doing. Some effective examples include: number 1, set rest periods to break up tasks. Number 2, frequently change tasks to limit repetitive movements. And number 3, simply try to work slower. Food is one thing everyone can control. This is very good news, as what we eat and drink throughout the day impacts our overall health and wellness. Pain is associated with inflammation. Certain foods tend to be more inflammatory than others. Dairy and gluten are common culprits, although by no means the only foods that can provoke an immune response. Everyone is different, and even healthy foods will sometimes trigger the production of antibodies against the food. This results in inflammation. A guided elimination challenge diet with a naturopathic doctor or dietitian may help pinpoint offending foods. Otherwise, there is food allergy blood testing that identifies which foods your immune system is attacking for a more targeted and efficient elimination of offending foods. Foods that provoke insulin production, like carbs and sugar, also exacerbate inflammation. Cutting back on sugar, bread, pasta, cereal, rice, and potatoes will have an anti-inflammatory effect. Constipation is a common side effect of pain medications. Getting plenty of fiber and water daily helps to manage this annoyance. Also, limit your intake of soda, tea, and coffee. Eating regularly keeps your energy levels up. Whole food meals help your body heal and help the effectiveness of some medications. Make sure to talk with your doctor or pharmacist to learn about any foods that should not be consumed with specific medications. Foods containing vitamin C and zinc help your immune system do its job to heal injuries. Vitamin C-rich foods include citrus fruit, kiwi, berries, and peppers. Foods that are high in zinc include pumpkin seeds, shellfish, beef, and egg yolks. Regular physical activity improves your body's strength, flexibility, and endurance. Chronic pain leads sufferers to rest more, which negatively impacts muscle mass and increases disability. Low-impact activities are ideal. Even 10-minute sessions a few times throughout the day improve overall well-being and reduce your risk of long-term disability. Exercises to try include cycling, walking, swimming, yoga, and Tai Chi. For most people, physical activity with a friend is more enjoyable than going at it alone. Try looking for live online classes where you can interact with the other participants and the instructor. When exercising at home, turn on your favorite music or TV show to help pass the time. The goal is to find something that you can do without making things worse and that you enjoy so that you'll stick to it. Think of exercise as a habit, just like brushing your teeth, something that you do every day. As stress levels increase, muscle tension increases too, often leading to increased pain. finding techniques to ease stress and tension will help you feel more relaxed. We feel stressed for many different reasons. Frustration, worry, fear, the options are endless. Managing stress helps you develop a more positive outlook. Meditation is a wonderful mindfulness technique for slowing down and focusing on your breathing, which in turn alleviates worrying about past or future events. A number of benefits are associated with regular meditation, including reduced stress, anxiety control, positive emotional health, enhanced self-awareness, sleep improvement, and pain control. Lack of sleep leads to fatigue, irritability, stress, and tension, all of which make it harder to cope with pain. Depression, sleeping too late, napping, caffeine, stress, looking at screens, and aging all contribute to sleep disturbances. There are a number of things you can employ for a better night's sleep. 1. Use your bed only for sleep. Avoid watching TV or other activities in bed. 2. Make your bedroom peaceful. Keep it tidy and clutter-free. 3. Avoid eating large meals right before bed. 4. Shut down electronic devices by 8 p.m. to optimize your melatonin production. 5. Avoid eating or drinking anything with sugar or caffeine. 6. Set up a nighttime routine. Try taking a warm bath before bed. Listen to some relaxing music. Read a favorite book. Do some gentle stretching, meditation, or deep breathing. Keep your bedroom cool and dark. Many people report their perception of pain changes according to what they are focused on. When pain occupies most of your thoughts, the pain becomes amplified. Changing your focus to a hobby, reading a good book, watching a favorite TV show, or engaging in an interesting conversation distracts your mind away from the pain. Brain research shows that specific areas of your brain are active when you experience pain. These same parts of your brain show lower activity when your attention is directed to something else during episodes of pain. Redirecting your focus during a pain period can be particularly difficult. However, with practice, it will become more easy. The more you are able to fill your conscious awareness with other, more enjoyable things to focus on, the easier it will become to change your focus. Challenge assumptions that you may entertain that being productive or happy is not possible when you have pain. Once you realize that pain intensity is influenced by your thoughts, you can take back some level of control over the pain. Cognitive behavioral therapy has been identified as a method for managing pain. This form of therapy aids people in developing skills to alter negative thoughts. By changing negative thoughts and attitudes, you can change your awareness of pain and develop coping skills. In clinical trials, cognitive behavioral therapy has been shown to alter the physical response in your brain by reducing stress. Stress levels affect norepinephrine and serotonin, which are powerful pain-influencing chemicals. By reducing the release of these chemicals through the way you think about pain, your body's natural pain relief response can be more powerful. Ergonomics is the science of refining the design of products to optimize them for human use. The goal of ergonomics is to minimize the risk of injury when doing certain tasks or using tools. Applying ergonomics in your daily activities can be as simple as improving your posture while sitting or standing. Being mindful of the way you might lift, reach for, or move objects helps to minimize the risk of injury during tasks. Many office settings offer ergonomics tips or tools for employee use. Check with your IT or HR department to find out what may be available at your company. No matter what type of pain you're experiencing, there are natural solutions for better pain management. Our wellness clinic offers a number of treatment options that can be tailored specifically to your needs. Options include chiropractic adjustments, electrical stimulation, massage and soft tissue work, acupuncture, osteopathy, naturopathic treatment for the underlying conditions that may lead to pain, such as fibromyalgia, interstitial cystitis, diabetes, and endometriosis. You and your practitioners can work together to develop a self-management plan, allowing you to have more control over your pain and your life. The techniques we discussed today include effective pacing, food choices, physical activity, ease tension, sleep better, focus, positive thoughts, and ergonomics. There are lots of possibilities for helping you manage your pain, regardless of the source. Talk to one of our wellness professionals, and we can help you set up a plan. Thank you for taking the time to watch today. Please don't hesitate to reach out if you have any further questions. You can post questions in the comments below and or email them to me at pfranknd@forcesofnature.ca. I promise I'll answer everyone. If you'd like to schedule an appointment with any of our practitioners, you can do so through our website at forcesofnature.ca or by calling 416-481-0222. We hope you found today's event useful. Several of you already reached out with questions. Thank you very much. Please share in the comments what you found most valuable about our time together. If you have any feedback, please email me at pfranknd@forcesofnature.ca. Please join us for our next webinar, which will be June the 8th at 7 p.m. It's a gluten-free recipe swap. Have a great evening, everyone.